In today's Daily Health, flu cases are surging across the country, and concerns are growing that some hospitals may not be able to handle the crush of patients.
But if there is a silver lining, it's that COVID cases are down this winter. Here's NBC News correspondent Marissa Parra.
A rising number of Americans are feeling the fury of the flu.
Me and my husband have had a 101 fever for 3 days.
CDC data this month reports over 6,600 flu deaths and 160,000 hospitalizations. While the flu is surging, COVID cases are down. Here's why. Doctors say COVID strains, for the most part, have become less severe over time. And this year, COVID peaked most recently in August.
COVID is milder this year, with about half the rate of hospitalizations now than exactly a year ago.
But the flu always peaks in the winter, spreading more easily this season with a combination of lower flu vaccination rates, record travel, a bitter cold winter season driving people indoors together, with little competition this season from COVID-19. It was just this week that the CIA made a big switch on their previous COVID-19 assessment. And just days after President Trump's CIA chief took his post, the agency now saying they believe with low confidence that the pandemic's origin was more likely a Chinese lab leak. And even though COVID hospitalizations are down from this time last year, doctors are still feeling the strain.
Is there a valid concern about the possibility of hospitals reaching capacity at this rate?
There is always a concern about hospitals reaching capacity, especially when flu cases are just overwhelming. So even those 1 to 10 extra hospitalizations from the flu can literally break a hospital's capacity. All the more reason to protect yourself today.
And it's not too late for protections like getting the flu vaccine. That, paired with washing hands more frequently and wiping down surfaces, can all help drive down the strain and keep your guard up. Marissa Parra, NBC News.
Now let's keep the conversation going with NBC News medical analyst Dr. Vin Gupta. So, Dr. Gupta, we just heard Marissa say that it's not unusual for flu cases to spike in the winter. So should we be concerned by this rise?
This is what we expect, exactly to the points that were made, and Clay, to your point. We're worried about the peak, though. And I do think the peak is going to be heavy in places like the Southeast, where we're seeing potentially a crush in hospitalizations that might overwhelm ICUs. And so that's the worry here, is regional overwhelming, but a peak that's probably similar to some of the worst seasons that we've seen over the last 10 years.
So take it seriously.
Yeah, absolutely.
Is some of that where it overwhelms hospitals because too many people go who maybe don't need to get that level of care?
To an extent. So the urgent care, the ER, the 6-hour waits, absolutely, Kate. Do you or do you not need to be there? And so high fevers, persistently 103 or higher, for about 72 hours, especially if it doesn't respond to Tylenol or something that's going to bring it down, like another type of anti-fever medication. If you're short of breath to the point that you can't catch your breath, or if you're going to feel like you're going to pass out, those are things that automatically should require an emergency room visit, or if you're medically higher risk. If you're medically higher risk, 60 years of age or older, or underlying condition, I'd rather you get tested.
Yeah,
and
a doctor.
Yeah, and if you've already had the flu, is there a chance you could get it again? And if you haven't, how do you keep yourself protected?
There is a chance, although natural immunity, we know, does work to a degree. Vaccination, we know, works to a degree. So, Clay, it's additive. I would say the things to keep in mind, especially for those that are medically higher risk. If you're traveling in an airplane, I say there's no harm to wearing a mask. It's going to help. Hand hygiene, as Marissa pointed out. Also important to keep in mind, if you're feeling unwell, to get tested as quickly as possible, because we know early testing, early treatment keeps you away from a doc like me. Also, if you've been exposed, Tamiflu for post-exposure prophylaxis, really critical.
And we've talked about COVID cases being down, lower numbers this year, which is a good thing. Should we let our guard down?
You know, what works for flu works for COVID. This is where I would say, especially through the end of February, vaccines, hand hygiene, masking when traveling, they all have broad applicability, protect us all. So I would not keep our guard down, especially, by the way, big elephant in the room, bird flu. There's all these other emerging threats here that we're just barely beginning to understand.
And of course, there's always those higher risk groups that we want to try and keep safe.
Absolutely.
All right, Dr. Vin Gupta, it's always so good to have you. Thanks for keeping us healthy.
Thank you.
Nice to have you in studio. Thank you. There is much more news ahead.
So don't go anywhere. You are watching NBC News Daily.